am Dr. Chandan Kumar Mishra, consultant endocrinology working at Medeor Hospital, Dwarka. I deal with both pediatric as well as adult endocrinology. Today I will be talking something about the disorders of one of the very commonly involved glands in the endocrine system, that is the thyroid gland. Thyroid gland is basically a butterfly shaped organ located in the front of the neck over here. The thyroid gland produces hormones which are commonly known as T3 and T4, and the production of these hormones from the thyroid gland is basically under the control of another hormone, that is TSH, which is known as thyroid stimulating hormone, which is produced from the pituitary gland in the brain. So a hormone, that is TSH, which is produced from the brain, is controlling the functions of the thyroid gland, and this production of thyroid hormones from the thyroid gland is controlling almost every organ and organ system of the body. Any deviation in the levels of the thyroid hormones can have manifestations which can range from subtle to very severe manifestations. So coming to the disorders of the thyroid gland, it can broadly be categorized into two groups of disorders. First is the hypothyroidism, that is when the thyroid gland is showing a lower level of functioning. In this scenario, the levels of the thyroid hormones produced by the thyroid gland are low and the manifestations of hypothyroidism result. And the second group is the hyperthyroidism, wherein the thyroid gland is functioning excessively, leading to excess of thyroid hormones in the circulation, and the manifestations of hyperthyroidism result. So coming to the symptoms of hypothyroidism first. Hypothyroidism is much more common than hyperthyroidism. The symptoms of hypothyroidism can be very variable and are very non-specific, and sometimes may not be appreciable, and patients may ignore these symptoms. The symptoms of hypothyroidism can be a feeling of tiredness, lethargy, weakness, weight gain, constipation. In women of reproductive age, it very commonly leads to menstrual irregularities, recurrent abortion, infertility, and one of the very common presentation of hypothyroidism in pediatric age group is the short stature and pubertal disorders. So if you have any of these symptoms or a combination of these symptoms, you should consult with your doctor and get your thyroid function checked if advised by your doctor. Next, coming to the symptoms of hyperthyroidism. So as already discussed, in hyperthyroidism, the thyroid gland is functioning excessively, and therefore the levels of the thyroid hormones are very high, and the manifestations can be variable, and it can be in the form of tiredness, uneasiness, dizziness, palpitation. Again, in women of reproductive age group, menstrual irregularities can be there, infertility can be there, abortion can be there, fractures can occur. Sometimes because of this excess of thyroid hormones, heart disease can also be a presenting feature. So if you have these combination of symptoms, then again you should consult your doctor, and if advised, you should go for your thyroid function test. Now coming to the treatment of both hypothyroidism and hyperthyroidism. The treatment is relatively simpler for hypothyroidism, while treatment is also available for hyperthyroidism. The important thing about treatment of hypothyroidism or hyperthyroidism is that you need to be compliant with your treatment, and you should be on a regular follow-up with your doctor. If you take your medicines regularly and follow the advice of your doctor and maintain your thyroid hormone levels in a target range, then you will experience remarkable improvement in your symptoms, and the quality of life will also improve. Thank you.